just add one thing to what Ginger said. I think there's this mad scramble to get political jobs in the administration. You should know there's probably only around 8,000 political jobs in the administration. So, the federal workforce of a couple of million. So, in order to put forward and advance the president's agenda, we're going to need the hard work and the dedication of a lot of career civil servants. So don't think that the only way you can serve us is by converting from a political job. And just to follow up on what Ginger said, also consider the ramifications of what happens when there's a change in administrations after you convert to a political job. We've actually had this situation already occur with a couple of folks who we knew were actually good Democrats serving in career jobs in the Bush administration over the last couple of years because they were told that you can get more responsibility as a political person. They converted to political jobs. And now all those people are being asked to submit their resignations. We're going to try not to do some of them, but we can't do all of them. So just be careful, if you want to keep your place in the civil service.
Thanks, Ginger. This is questions for Bob. In attempting to keep the transition process transparent and open, the Obama-Biden team has relied heavily on the use of the internet. Well, basically this question is asking, because I'm trying to read the handwriting here, is that there are those who don't have access to the internet and technology, and those who are limited English do not have the resources to access the internet. How do you tend to reach out to those who don't have the resources and access?
Thank you. That's a great question. We talked about that a lot. In fact, I had a great conversation with former Congressman Bob Underwood of Guam about this very issue, that we need to make sure that we're not just thinking online, that we also have to think of an offline way to reach out to our communities. So throughout the transition process, many of you participated on conference calls that we had. We went out personally and did as many meetings as we possibly could, the face-to-face interaction. But the real key here is, as we said during the campaign, this has to be sort of a train-it-forward mentality, right? The reason why I did all the conference calls and the webinars and we did all the meetings is because the goal was you're leaders and your job is to go back to wherever you came from, to the constituencies that you talk to, and spread that information around. We can't rely on a small network of people to constantly feed the information out there. The other thing that we talked a lot about was making sure that we, as part of this economic recovery package, a discussion was making sure that libraries were able to, access our resources so that people could go to a central location in their communities and find out what's going on with the administration, be able to post their resumes, be able to have a direct conversation with us. But I think the impetus is on us, because nobody knows our communities better than we do. And I think when it comes to language access, this is one of the key things that I think we're going to be dealing with in this administration for our community, is how do we make sure that the 60% of Asian Americans, a lot of our grandparents and first-generation folks who came here, who have limited English proficiency, how do we make sure that they're understanding what's going on as well, that they're engaged in this? And I think that's particularly important in politics, because when I worked at the DNC for 3 years, I traveled to 49 states and managed to train 22,000 people. And what occurred to me was, in all these locations I went to, it was amazing to me how little people understood about the political process. And especially in our community. A lot of our families come from countries where politics is not respected. Where politics is not thought well of. My parents, when I chose to go into this profession, besides being devastated that I'm not a doctor, although I had them feeling good about it when you guys hired me to work in the transition until Sanjay Gupta got leaked. Because then they came back and they're like, well, couldn't you be both? So thanks a lot, Dr. Gupta. But the point was that they didn't have a good view of government because their impression from India was that government is corrupt and government doesn't actually do anything. And part of our job during the campaign and the transition was to start changing that idea. And a lot of that requires language access. So we talked with groups that do translations. During the campaign, we frequently relied on volunteers who would help translate our materials. And I think in the previous panel we talked about what APIAVote did in language. We also similarly on the Obama campaign did a lot of translations in language. We also released the first ever AAPI blueprint. No presidential campaign has ever done that before. A 60-page document that laid out our issues, and then we translated it and provided it to folks so that folks could understand exactly what Barack Obama and Joe Biden wanted to deliver for our communities. So it's an ongoing process, but it's a partnership. And this administration said again and again, we're going to need every one of you to be involved in that.
There's a question. Since you mentioned the blueprint, and I recall reading the blueprint, okay, 80 pages of blueprint, which is, as you're right, it's unprecedented to have a policy platform in there. The question is, the White House Initiative on Asian American Pacific Islanders, that was in the blueprint, and we mentioned earlier that Ginger was a member of the White House Initiative, as well as Secretary of Government, who was the first chair.
Escort these people.
What is discussion within the transition and for the administration to be on reinstating the White House Initiative of Asian Pacific Islanders?
Let me give a quick overview and I'll let Chris talk more.
Sure.
Okay. So, for those of you who don't know, in 1999, President Clinton signed an executive order, 13125, to create a federal-wide initiative on Asian Americans and Pacific Islanders. There's a history to this because the previous minority initiatives on historically black colleges and universities, tribal colleges and universities, and Hispanic serving institutions had all been based in the Department of Education. Because for those three constituencies, the primary disparity that the government wanted to address was access to higher education. So I think Carter and Reagan and Bush the first had created the previous minority initiatives. President Clinton, under his administration, there was a survey done by the Department of Health and Human Services as part of their Minority Health Disparities Council. And out of that survey, what they learned is that our communities, which have been long thought of as a model minority that didn't really need a lot of attention from government, faced huge disparities, not just in healthcare, but across the board in all these indices of education, jobs, and breaking the glass ceiling in federal employment. So out of that effort, Secretary Shalala and President Clinton decided to create a White House Initiative on Asian Americans and Pacific Islanders. And it had three basic components. There was my area, which was the White House Commission that reported directly to the President of the United States. Secretary Mineta was the first chair of it, a 15-member commission of experts and community leaders who would go out and bring the best intelligence about our community's needs. I see Susan Cox in the audience. Susan Cox was another member of the commission. And I see Tessie Guillermo, who actually, Tessie Guillermo's organization, the Health Forum, that she headed at that time, was instrumental in helping create that executive order. So we owe Tessie a huge debt of gratitude. The second component was the community outreach, which was done by my friend Lisa Hasakawa, who's wildly waving her hands out there. Lisa's job was to engage the community and make sure that the community was part of this process, providing testimony and input and data directly to the work of the commission. And then the third component, perhaps the most important component of this initiative, was a federal interagency working group. This was made up of the deputy secretaries of every single cabinet agency and the deputy administrators of about a dozen sub-cabinet agencies. Each month, this interagency working group met together to try and figure out how do you implement policies across the federal government that will increase participation and access of our communities into federal programs. It was an unprecedented initiative, and in the short period that we had under the Clinton administration, we accomplished an enormous amount. In fact, I still can recall the day when Susan and Tessie and I and Lisa, we went to President Clinton 3 days before the end of his term and presented a report to him laying out the key disparities and concerns and issues and priorities of our community and laying out the recommendations. What's unfortunate is that 8 years later, that report is still valid. It hasn't been changed. It hasn't been fixed. And so, in the last 8 years, the White House Initiative has basically been moved out of HHS and into the Department of Commerce. It has been given a very narrow focus on small business, and basically it's defunct right now. During the campaign, the President-elect spoke multiple times, publicly and in the API blueprint and the Democratic platform, about the need to restore the White House Initiative on APIs. It's a commitment that we have to get it done. The question now is the mechanism. How do we do it? I don't necessarily believe that the way it was under the Clinton administration was perfect either. We know that there were a lot of deficiencies in how we were set up because it was done very ad hoc. We were funded basically on the goodwill of division heads at HHS. So we don't necessarily want to go back to that model. Clearly the model of the last 8 years hasn't worked either. So this is going to be one of those things where over the next few months, we as a community will need to sit down together, working with the leaders of the new administration, to figure out where is the best place to house this initiative, to fund it, to give it the federal-wide scope it needs, and give it an agenda that will actually benefit our community quickly and in the short term, but also thinking long-term about the larger needs that we want to address. So this is something that we're committed to doing. We now have to figure out how to get it done.